in-treatment clinic options in terms of the treatments that we have, which are based on the mechanism of action around retinoid-based treatments or topicals. But with that in mind, and again, as I say, for those of you who are familiar with our portfolio or maybe using other products that we have within the AestheticSource portfolio, you will know that we have so many different clinically proven ingredients that are actually able to treat acne and certainly different signs and symptoms of acne. But as I say, for today's focus, we will be looking very much in and around the mechanism of retinoids and what we can do in terms of this very important and unique classification of treatment. Now, I think this is an important slide that I just want to spend a few minutes on, because I think in aesthetic practice, we tread sometimes a very fine line in terms of how we assess, sometimes how we treat, and what modalities or treatments we have available in terms of treating acne. In terms of the medical classification versus the cosmetic indication for treating acne, sometimes this can be a very, very fine line. And for sure, when we put this in context of understanding our duty of care, if you like, and our competence in aesthetic practice in terms of how far we go, in terms of the types of symptoms that we treat with acne, this is really where the classification, the current guidelines in terms of gold standard treatments come into play in terms of the retinoid classification of ingredients, as an example. So I think it's important for us, I'm sure that these clinical guidelines we're going to be looking at are very much a revision for most of us. I know we're familiar in terms of what we are doing, what we should be doing, and at what point we decide to refer on when we are uncertain around things like diagnostic uncertainty, perhaps a failed response, or maybe where the presentation itself is far more complex, because acne can often have a number of different differential diagnoses, and many of these often these other differential diagnoses can actually overlap and coalesce with each other. So I think whether we are a nurse, doctor, dentist, therapist, whatever our professional background, we all still have a duty of care to work within our clinical competence and to treat signs of acne where we know we are able to do so and where we are the right person to do so. So I've taken some clinical images here from the DermNet New Zealand site, which is a phenomenal open access dermatology resource that's available. There's an absolute plethora of information on here, even on areas of cosmetic dermatology. It's not just focused on the medical side of dermatology in terms of all the different skin conditions that they have on there. And many of their images like these are able to be used for educational purposes, but these give us such a nice insight, I think, and clarity in terms of the different signs, the different symptoms that we can see across different types of acne. Of course, we know it's a condition that affects all different Fitzpatrick skin types. We know in darker skins, as an example, as you can see on the top left-hand side of the screen there, that this may present more with areas of sort of more post-inflammatory pigmentation, and certainly these skin types are more prone, if you like, to different types of scarring, even keloid arising from from the signs and symptoms of acne. When we look at the top right-hand side of the screen here, we can see these are open comedones, which again are a very common sign that can often occur in isolation or with any of the other symptoms that you can see here on these images. If we look at the bottom right-hand side as an example, we have areas of notable inflammation in and around the perioral region and also the lower face, with areas of pustular eruption as well as actual closed comedones, which the image on the bottom left-hand side there as well gives you a nice overview of the presentation of closed comedones. So it's important we've got a good understanding and overview of clinically what we're looking at in terms of acne. So looking at the context and the background with this, really, in terms of trying to get some clarity and some idea around how common it is, as an example, really I've tried to go to the best gold standard guidelines that we have. So as you can see, the reference on the bottom of the screen here, these are part of the clinical knowledge summary guidelines from the NICE organisation. And again, depending on the source or the paper that you read in terms of the prevalence and the statistics, these figures, of course, can vary to some degree, but it's thought at present there's an estimate of around about 650 million people affected by acne worldwide. But again, the prevalence varies hugely in different geographical areas, with often Western, more industrialized countries having a much higher rate of acne than some non-industrialized countries, which may be significant. And certainly approximately up to 95% of adolescents in Western industrialized countries are certainly more affected to acne to some extent as well. About 20 to 35% are thought to develop even moderate to severe acne. But fundamentally, when we're talking about acne generically, we are talking about a condition Acne vulgaris is a chronic inflammatory skin condition that affects mainly the face, in many cases, the back and also the chest. So it's characterized, as we've seen with those images, by blockage and a degree of inflammation of the pilosebaceous unit. So that very important unit classified as the hair follicle, the hair shaft and the sebaceous gland. It will present with lesions which can be non-inflammatory, inflammatory, or as a mixture of both, as we saw very clearly on those images before. And those non-inflamed lesions are known as comedones, which could be open, closed, or even microcomedones. But inflammatory acne lesions include papules, pustules, 5 millimeters or less in diameter, and in more